Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about magnesium, the forgotten mineral. Oftentimes when we talk about minerals, we often think about calcium. Calcium from bone health, osteoporosis, and so forth. Magnesium is kind of a missing piece when it comes to mineral uptake. So let's go into how we discover if we have magnesium deficiency. Now, when they look for magnesium in your regular blood work, it says magnesium. That's serum magnesium, and that's not a great indication of what your magnesium levels are. If you're going to check for magnesium, you want to check it in the red blood cell magnesium. That would give you a better read of what's going on. Also, with magnesium, there are a lot of little subtle clinical signs that might indicate you have magnesium deficiency. So we'd like to go over some of the signs and symptoms, and then we'll go into what forms might be the best and what I use in my office to help patients, okay? So essentially, essential mineral, which is a cofactor in over 300 enzymatic processes or reactions, right? It's involved in protein synthesis, muscle contraction, nerve function, blood pressure, hormone binding, and other things. There's a lot of them, right? Because there's over 300 enzymatic processes that magnesium is involved in. Now, some clinical signs and symptoms of deficiency. Muscle cramping, usually at night, sleep disturbances, stress and anxiety, right? You feel wired and tired and you're highly stressed, right? High blood pressure is also another clinical sign. And then you're going to have constipation for some people because you need magnesium for muscle motility and contraction in the colon. And then you're going to have some people who have fatigue, heart palpitations, or some people who have Afib or atrial fibrillation, cognition, and then headaches, things like migraine and so forth. So there are a lot of little clinical signs and tips here of possible magnesium deficiency. Now, when we look at the different forms of magnesium, there are a lot of them, and let's just go into some of what the research says, okay, in terms of magnesium. So there's magnesium aspartate, is 42 to 45% absorption, right? And absorption primarily occurs in the small intestine and partially in the colon or the large intestine. So magnesium aspartate has 42% to 45% absorption rate. The reason I don't use it is because aspartate is an excitatory neurotransmitter. So the purpose of magnesium is to kind of calm things down, to rest, to relax, and so forth. But if you combine it with aspartate, which is an excitatory neurotransmitter, then you're kind of having the push and pull of an opposite effect when it comes to magnesium. Another one is magnesium lactate, it's 42% absorption. Magnesium citrate is 30% absorption, and usually very good for people who have constipation, right? Magnesium citrate. There's magnesium glycinate, which is a 24% absorption rate. And the reason I like magnesium glycinate is because glycine is a precursor to GABA, right? And GABA is an inhibitory neurotransmitter, so it calms things down. So you have a calming effect of glycine, and then you have the calming effect of magnesium, which has a profound effect, not just the effect of 24% absorption, but a clinical outcome effect. You have magnesium chloride, is 20% absorption. We like to use that when we have people who have low stomach acid issues, because chloride is used in hydrochloric acid. So you can use that for people who have maybe some low stomach acid issues or reflux issues. And then you have magnesium sulfate. It's only 4 to 7% absorption rate, right? They've actually used magnesium sulfate in studies for atrial fibrillation, and they actually had pretty good outcome with it. And they used a form that's not even highly absorbable, and it still had some clinical outcome that was positive. They also use magnesium oxide, which is a 4% absorption rate in some other studies, And even magnesium oxide, which has a 4% absorption rate, still has some positive outcome in the studies. So the half-life of magnesium is about 1,000 hours. So you don't have to necessarily take magnesium every day, right? You can dose up in 2-3 days a week. But what's important is, how do we use it, right? How do we use it in our office? We have all these numbers and statistics of how you can use magnesium or the absorption rate, but in clinical practice, how do we use it? In my office, we like to use magnesium glycinate. Like I said, glycine has an inhibitory effect on GABA, right? So, glycine is a precursor to GABA. Therefore, you have an inhibitory effect on your nervous system, along with magnesium. So if we wanted just a general use in our office, we'll use magnesium glycinate, right? It's a great way to have a calming effect. Magnesium citrate is for patients who have constipation. So if they have some constipation issues, until we can work some things out to help improve constipation, we may use magnesium citrate to get the bowels moving, right? The one we like to use for brain or sleep is magnesium threonate, right in here. This has a great effect on the nervous system, right? Particularly NMD receptors for the nervous system, because magnesium threonate can cross the blood-brain barrier, right? It doesn't just work on muscle tissue or etc., but it crosses the blood-brain barrier and has a neurological effect. So magnesium threonate is a great one for that. So I tend to use these three in our office. Now, there are other forms that are good also, like magnesium malate. You can use magnesium chloride. But at the end of the day, we don't have 50 different supplements for magnesium, but we can use these three in conjunction to help patients with their health conditions. Now, there are companies out there that will use a combination. They'll use magnesium threonate, glycinate, and maybe malate to help, or even citrate. So you can use a combination formulation for magnesium, which can have a pretty good outcome. Now, we use a lot of magnesium threonate for people with anxiety, maybe even depression, or even ADD, ADHD. So it's a great form of using to help calm the nervous system. Overall, magnesium is needed, right? At the end of the day, we are deficient. I believe the RDA is somewhere on like 350. But for most people who take in magnesium from diet, etc., they're significantly deficient, even for RDA. So what we like to do in terms of dosing for patients is this. We know most patients are deficient, and RDAs are just under 400. So we would like to dose at between 200 to 400 milligrams at night. So it has a calming effect at night. Deeper sleep, better sleep means overall health improvement and healing, right? So we can use this as a starting point. And sometimes I've gone as high as 1,000 milligrams of magnesium, especially things like magnesium threonate when we're trying to affect the brain, and have a profound effect. But you have to kind of play with these numbers, right? Because you can't just go ahead and say, I'm going to take 1,000. You might have loose stool, even if you're taking like magnesium glycinate, right? You can still get loose stool, so you got to be careful. Overall, you don't have many side effects with this. You can use it with a lot of these medications, heart drugs, and so forth. I think there's some cardiologists out there who would agree with that. So you can use magnesium with even some of these medications out there. But always ask your physician. If you're on 10 different medications, you always want to ask your physician whether it's safe to take. Okay. Today we're going to talk about my top 5 magnesium forms that we like to utilize in our office. So let's get right into it. So let's recap. Signs and symptoms of magnesium deficiency: muscle spasm, sleep issues, stress and anxiety, hypertension, constipation, fatigue, heart palpitations, atrial fibrillation or Afib, cognition issues, headaches, especially with migraines, asthma, and preeclampsia. So you can utilize it for hypertension during pregnancy. Cofactors. Magnesium is a cofactor in over 300 enzymatic processes. So it's very important for a lot of different functions. So let's give you an example. When you have vitamin D, which is the inactive form of 25-hydroxyvitamin D, magnesium is a cofactor to make inactive to active 1,25-dihydroxyvitamin D. So it's an important cofactor in the conversion of inactive to active forms of vitamin D. Once 125 is made, 1,25-hydroxyvitamin D also helps with the uptake of magnesium. What kind of foods have magnesium? Avocado, almonds, dark chocolate, pumpkin seeds, spinach, Swiss chard, quinoa, sunflower seeds, flaxseed, Brazil nuts, bananas, and salmon. So a lot of different foods out there, and you can just go and Google the list of different foods that have high magnesium. But essentially what happens is with magnesium deficiency, there's so many things that can happen. That's why it's so crucial to have enough magnesium in our system. So what are my top forms of magnesium? Let's get right into that. Number one is magnesium citrate. Now it's not in any specific order of importance, it's just we're listing it. Magnesium citrate. Magnesium is bound to citric acid, basically found in fruits, and it's a good form of antioxidants. It's highly bioavailable and absorbs very well in the GI tract. Okay? It's utilized for migraines and constipation. Okay? Now all magnesiums will have impact on migraine and constipation, but magnesium citrate is especially good for constipation. Magnesium glycinate is magnesium is bound to glycinate, used for protein synthesis. So glycinate is an amino acid which is utilized to make protein. Good for athletic performance and recovery and general body and muscle health. Glycine is also a neurotransmitter, so it's good for sleep and depression. Okay? Number three, magnesium L-threonate. It helps with brain function and cognition and memory. So it's an excellent magnesium form that crosses the blood-brain barrier, and makes an impact on function of the brain. Magnesium taurate is very similar to magnesium L-threonate. Crosses the blood-brain barrier. It's good for migraines. It's also been shown to help with diabetes or insulin resistance. In some rat studies, it also shows that it reduces or slows down the process of cataract disease in the eyes, which is a leading cause of blindness. Number five, magnesium sulfate. Basically Epsom salt. You can absorb it through your skin. So if you can't tolerate magnesium supplements, you can take an Epsom salt bath and you can increase your magnesium levels. In the emergency room, they'll also use it as an IV, and it uses it for like acute issues with breathing, asthma, and preeclampsia. So magnesium can be utilized in many different forms, and it can be utilized very effectively if you know which form makes the most impact for certain conditions. Okay? Today we're going to talk about magnesium and vitamin D. How does it work? What does it do? And what kind of dosages should we take in order to enhance our vitamin D? Now, I've made videos on vitamin D before, as well as magnesium, so you want to go back and watch those videos. But today we're going to talk about why we would use magnesium to enhance vitamin D metabolism. So let's get right into it. Vitamin D and magnesium. Magnesium assists in the activation of vitamin D. It's involved in over 300 enzymatic processes in our body, right? Magnesium is the fourth most abundant mineral behind calcium, potassium, and sodium. Now, when you look at vitamin D, there is an inactive form called 25-hydroxyvitamin D, right? In order to convert the inactive form to the active form of 1,25-hydroxyvitamin D, you will need magnesium because it will enhance the enzymatic processes that occur to get it to the active form of vitamin D that can be utilized. Now, when you have increased levels of 1,25-hydroxy or active forms of vitamin D in our system, it will also increase the absorption of magnesium in the GI tract. So it has a multifold effect. They're synergistic, right? They help each other. Magnesium in food is declining by over 25 to 85% compared to the 1950s. What that means is that our soil is being depleted of its nutrients, right? It should be rich in minerals and so forth. However, it's being depleted over the years due to farming practices. The most important thing here is how much do we take, right? That's the main question that a lot of people want to know. They want to know how much should we take. So vitamin D and magnesium. So recommendations. If you're not testing for vitamin D levels, you want to be on the lower end. If you're testing properly, you can take higher doses of vitamin D and have more of a profound effect. So my suggestion is always to test your levels of vitamin D, and it's best to do it on blood work. Now, if we're not testing, I would keep it under 5,000 IUs or international units. So you can take maintenance dosages of vitamin D, 2 to 5,000 units per day. You can take magnesium up to 2 to 400 milligrams per day. Now, I've used up to 1,000 milligrams of magnesium on patients. However, magnesium can create loose stool, etc. So you want to go ahead and understand how magnesium works. Like I said, I have another video on that, so you want to watch that one. So that would be a general basic recommendation. Now, in order to enhance or make sure that we're not creating problems with calcium and so forth, you can also take K1 or K2. K1 is from plant extracts, and then K2 is from animal products. Also, other fat-soluble vitamins should be taken into consideration, vitamin E and vitamin A. Now, other considerations for absorption of vitamin D. You should take it with a fatty meal because vitamin D is a fat-soluble vitamin, so it enhances absorption in the GI tract. You also have to make sure your gallbladder is functioning, or if you had your gallbladder removed because of gallstones, etc. You can supplement with ox bile or choline, and there are other things you can do like milk, thistle, and so forth to enhance your gallbladder. There's a separate video on gallbladder, so you go ahead and watch that one. And now, vitamin D target levels. What is our target in our blood work when we take vitamin D? Now, the lab ranges can vary from company to company, so it can be anywhere from 30 nanograms up to 100. I say our target should be between 60 and 80 nanograms per milliliter. So when you check your blood work, go ahead and look to see if you're in this target range, because it's very important to get your levels to a good level in order to help viral replication and enhance healing after, if you do catch viruses, right? So it's very important to do that. Today we're going to talk about magnesium and high blood pressure or hypertension, and what is the stance by the FDA regarding food labeling regarding hypertension and magnesium. So let's get right into it. Magnesium is good for moods, migraines, premenstrual syndromes. It's involved in over 300 enzymatic reactions. Therefore, it's important for protein synthesis, nerve and muscle function, sugar regulation, and blood pressure. Okay? What types of foods have magnesium? Things like avocados, nuts, seeds, spinach, whole grain, legumes, yogurt, salmon. What is the RDA recommendation for magnesium? Ages 1 through 8, 80 to 130 milligrams per day. 9 through 13, 250 milligrams per day. An adult male, 430 milligrams per day. And an adult female, 320 to 360 milligrams per day. Now, most adults do not get the minimum requirement or the minimum RDA requirement of magnesium. What that means is they usually will need to supplement or change their diet in order to get the proper levels of magnesium into their diet. Now, I have a separate video on magnesium itself, all the different forms, dosages, etc. So I want to link that video below so you can watch that video. So this will make a little bit more sense to you. Now, what does the RDA or the FDA say? So there's extensive research on cardiovascular disease and magnesium, especially with hypertension. So the FDA came out in January of 2022, and it basically says it does not intend to restrict claims of benefits of magnesium and hypertension. So the statement really says, if the food that you're eating, or whatever packaged food, has more than 20% of the RDA, or 84 milligrams, up to 350 milligrams per serving, then they can make the statement of it may have potential benefits to hypertension. They can't claim that it reduces hypertension, but they can claim the likely benefits or potential benefits of magnesium and hypertension. That's big in a way because they're starting to recognize that there's extensive research out there for magnesium, and they're acknowledging that, but they don't want to come out and say that it cures or takes care of hypertension. Now, there are other studies, right? They've used 240 milligrams per day for uncontrolled hypertension. What that means is a person who is on a medication for hypertension can take 240 milligrams and it will reduce their systolic and diastolic blood pressure. Now, for the untreated hypertensive patient, they can use up to 600 milligrams or more to help manage hypertension, right? So these are the studies out there, and I'll link those studies below. Interestingly enough, they say dose matters more than the type of magnesium. So it's not the type of magnesium that you're taking that's going to lower your blood pressure. It's the dosage that's more important, right? Although one can argue that certain magnesiums have benefits, like magnesium citrate is important for, let's say, constipation. Magnesium glycinate is a good form for general health and magnesium absorption. Magnesium L-threonate can be great for nerve function or brain function or calming the mood and sleep. So there are other benefits to these types of forms, but the basic idea is that the dosage matters more than the actual form of the magnesium to reduce hypertension. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.